So hello everyone, once again, Natalia, Alvaro, who are joining online. Nobody, sadly, is joining physically in the office for this session, but we are going to have it anyway. Just to give it a quick presentation, like I did with the other talks for the other sessions. This is part of the mental health campaign that we launched in March. We are focusing this month on sleep disorders and, well, how healthy sleep impacts our life and our mental health and mental well-being. I'm glad that Alejandro and Daniela are joining me today. They prepared this session very carefully and with a lot of love, and I'm sure that we will get a lot of information out of it. We will have a quick section at the end of this session for any Q&A. So if you have any questions, Natalia, Alvaro, you can post them on the chat, and I will tell Alejandro and Daniela afterwards. So thank you. Let's start it.
Well, thanks to you for having us here. Thank you very much for all of those who have joined. Really appreciate it, no? So we can feel a little bit back on our presentation. So without further delay, I would like to hand over to Dr. Silva so she can self-introduce herself.
Thank you very much, Alejandro. Everybody, hello. My name is Daniela Silva. I am the new, not that new. I joined Cigna about 3 months ago, and I'm the new Dr. Cigna. So if you ever have to use our own telemedicine service, I will be the doctor responsible of your care. And today I'm joining Alejandro in this really special talk. Oh, it's not working properly. Okay, thank you for letting us know. I think maybe we can step forward that way.
Thank you. Let's see how we can fix it.
Okay, so maybe just stand up.
Maybe here, is this better? If somebody can just let us know, because it seems we're recording the session. It's important. I can see you. Okay, good. Perfect.
Okay, is it better now?
Yeah, well, I think so.
I'll take it as a yes.
Okay, so yeah, I'm happy to join Alejandro, and we're starting the session.
Thank you very much. So for all of those who don't know me yet, this is Alejandro. I work for Cigna Healthcare Europe as a medical advisor on Cigna Healthcare Europe clinical team. Good to have you here, and good to have this important initiative from our health and safety department. And thank you very much for granting us some time today to come about this very interesting topic. Some of you may be already familiar with this campaign, with the Big Healthy logo, etc., but could be at this point in time still asking yourself, why talking about sleep in the midst of a mental health campaign? This is the list of topics we would be covering today. I hope you can get out of this session with a good bunch of concepts. As Raul has said, we have saved time at the end of the presentation for questions and answers. However, if you have any particular question on the specific content on one of the slides, I do invite you to raise your hand virtually, of course, and let us know so we can cover it on. So we are going to invite you to have a 2 minutes read to this list of topics. We would like to start setting the tone, by transmitting to you some of the feelings we have gathered across many years on sleep and sleep disorders. Nowadays, we are bombarded by information coming from different sources, and it's very likely that you have been receiving information about sleep and the quality of sleep since you were younger. Some of them are reality, some of them are myths, and we hope this session is helping you to demystify, if we can say, and to confirm which ones of these are true or not. So, again, why sleep? First of all, because sleep disorders and the pathology around sleep is very frequent, is very prevalent in our society. Obviously, sleep disorders vary depending on your age, social context, etc. It is not the same when you're a young person, when you're a child, when you're an adult, when you are older, but also in the 19th century, pathology and the problems around sleep are not the same we have nowadays. We have just gone out of a very special moment in our life, which was the pandemic. And we've seen that prior to the pandemic, during the pandemic, and now in the post-pandemic area, the pathology and the conditions around sleep disorders have changed and have varied as well. But overall, if we have a look, if we take a snapshot of our population, there could be variances, but we tend to accept that 40% or up to 50%, depending on the location of our population, is suffering or reports having suffered from sleep disorder through their lifetime. So this is truly prevalent, it's truly frequent. And next thing I would like to talk about is the difference between sleeping and resting, because these two concepts, the first one of our fake for today, is causing delay into identifying that there is a sleep disorder and seeking for health. And I'm talking about seeking for healthcare and seeking for help, because this is a true problem. And sometimes we are very knowledgeable about the physical impact on health from sleep disorders, not sleeping well, but we tend to forget, or we are not aware sometimes, that there is a mental health component as well tied to the sleep disorders. So both the physical consequences of not sleeping well, we will cover during this session, if prolonged in the long term, plus the direct consequences of not sleeping well, the direct consequences on mental health, they both add together and tend to provoke or to cause more pathology in the long term. So it's crucial that we learn to identify problems, that we learn to detect them, that we get into a culture of seeking health care or seeking attention or help, when we are suffering from this, but also understand what are the consequences of leaving that unattended. At this point, we are all more or less in agreement that this is important, that this is a problem. But why is that so important? My colleague, Dr. Silva, is going to degrain all of this you can see in the screen over the next slides. But I want you to start with a concept. Sleep is important because of what happens meanwhile you're sleeping. Sleep is a period in which the body recycles, if we want to use that term. We take all the learnings, all the lessons, all the results from the different interactions we've had with other colleagues, with the environment, etc., and we use it to consolidate memory, to consolidate learnings, to adapt organ functions, to adapt processes, internal processes, etc. So it's easy to infer that the first consequence of not sleeping well has to do with not allowing sufficient time for the body to recover and to reset these questions. And especially I would like to call over the importance of sleep in preserving mental health. Mental health is impacted as well for the physical consequences of not sleeping well, as we've said, but also direct consequences. And that thing we traditionally had considered until now, when we see someone, hey, you're very irritable today, go get some sleep, please, because I cannot stand you, and sorry for using this informality here. But every day more and more it is demonstrated in studies that sleep disorders impact mental health, have a direct relationship with wrath and the way, for example, we respond to the stimuli of the media. And since we are all social and we all live in society, it's very important to preserve mental health and ensure quality of sleep, not only because of ourselves, but to facilitate that we are all living together in peace, tranquility, and harmony. And with that said, which I hope sets the tone for the rest of the conversation, I'm handing over to Dr. Silva so she can go into it.
Okay, thank you so much, Alejandro. I always like to start with this statistic, actually, because I think it's really remarkable when we think about it. We spend about 1/3 of our lives sleeping. Okay, so it must be important. We say 30% of our lives we're sleeping, so it has to be important. So what does healthy sleep mean? Because we all sleep at night, or at least we should be sleeping at night, but we maybe not sleep properly or we don't feel well rested. So what does healthy sleep mean? And in order to be able to talk about healthy sleep, we need to talk about circadian rhythm or circadian clock. And I think everybody has heard about that term. So what does it mean? It means it makes reference to how our body responds to external light stimuli, which is the daytime, the daylight, and the darkness at night. Okay, so during one circadian rhythm, or the circadian clock, involves the function of two very important hormones, which are cortisol and melatonin. Okay, and these two hormones really regulate the circadian clock. When we go to bed at night, we usually have an increase in melatonin, which is a hormone, a very important hormone that makes us fall asleep. That is a sleep inductor, and it's released naturally by our brain, by a gland called the pineal gland, which is a little gland in our brain, and it makes peak in the middle of the night. Okay, so it starts rising with the darkness of the afternoon, nighttime, and then it sort of peaks in the middle of the night, and that helps us sleep. And as we move forward during the night, the melatonin levels drop in our blood, and then we have, as you can see in the black line, we have a rise in a very important hormone, which is called cortisol, which probably you have heard of. Cortisol is a hormone that in excess, it's toxic. It's the inflammation hormone. It can be cause of several conditions and diseases, but it's really important in adequate quantities because it's a hormone that makes us ready for the day, that gives us energy, that allows us to carry on with our day normally. Okay, so if we have some sort of issue, or if we have an altered circadian rhythm, we're going to have alterations in these hormones, and these are not going to let us have a healthy sleep. Okay. And basically, how do we know if we're getting healthy sleep? Of course, we're going to talk about sleep hygiene measures, and all the hormonal and scientific aspect is important, but really it comes down to whether we're feeling rested in the morning. So if we're having restorative sleep, if we go to bed at night, we have a good night's rest, and then in the morning we feel like we are, ready to go with energy for the next of the day, for the following day. And actually, statistics are not very good right now. Study in the US in 2022 reported that about 30% of participants, 30% of Americans have non-restorative sleep. And this was based on questionnaires, objective questionnaires, where everybody was given a punctuation, a score, and the conclusion was that about 30% of Americans do not have restorative sleep, and the statistic is pretty similar here in Spain. According to the Spanish Society of Neurology, we have 30% of people who are not getting restorative sleep. So this is concerning. And it's not only about quantity, because we may sleep, 8 hours, 7 hours a day, but it's also about the quality of our sleep. Are we getting that sleep with quality, with the actual, with all the phases of sleep, with all the cycles of sleep that we need to feel well rested? And this is important because in every phase of sleep, we have very important functions. So in a regular night, we spend about 7 to 8 hours sleeping at night. We're going to go through several cycles, and each sleep cycle has a different duration of non-REM sleep and REM sleep. So basically, just very quickly, sleep is divided into two big phases. Rapid eye movement sleep, which is the phase at the end of the night when we have vivid dreams and when we have dreams, basically, and it's a very important phase. It's actually demonstrated to be important in insightful thinking, in creativity, so it's really important. And then the non-rapid eye movement phase, which is a little bit longer in the beginning of the night, is as important because in that last phase of the non-rapid eye movement sleep, which is the deep phase sleep, we're going to have a lot of processes, very important processes going on, such as tissue repair, memory consolidation, immunity boost. All the immune systems get strengthened and regenerated, and basically the deep rest that we're going to require for the following night. Okay, so I just wanted to mention that. Just going forward, I wanted to mention just these are the sleep disorders, are the most common sleep disorders. All of what we're going to talk about today talks about improving our actual sleep, or sleep hygiene, our sleep, if we are healthy. But if we have any sort of medical conditions, sleep disorders, such as insomnia that we cannot treat with regular sleep hygiene measures, or restless leg syndrome, or narcolepsy, which is people who get, fall asleep during the day all of a sudden, or sleepwalking or obstructive sleep apnea, we must look and seek for care. As Alejandro was saying, it's really important that we all seek for medical care if we suspect any sort of medical condition or medical sleep disorder, okay? Jet lag is a little different. We're gonna talk about that when we talk about supplementation and melatonin, because jet lag is that alteration in our sleep rhythm as a consequence of a change in circadian rhythm because of the time changes when we move from one side of the world to the other. So this is just a little different. So basically, poor sleep quality is associated with different diseases. This is a list of diseases that we can associate with poor sleep quality. I'm not going to go through every one of these here because we're going to talk about them on separate slides. So to start with, sleep is associated with obesity and metabolic health. When we have less than 7 hours of sleep at night, studies have demonstrated that there's more risk of overweight and obesity. So there's a direct link between poor sleep and increased body weight. And why does this happen? Well, there are several mechanisms that are proposed that can explain this phenomenon. When we sleep less, that many times is associated with an increased time using screens. If we have more time using screens at night, we know there's less production of melatonin. We're going to sleep less. We're going to wake up in the morning feeling fatigued, feeling tired, feeling not well rested. And as we said before, when we start the day, we have this rising cortisol, which allows us to have this energy for the day, to endure the day. But if we're tired, we're going to have to find that energy from somewhere else because we haven't had appropriate deep sleep. So what do? We look for caloric food. We look for pizzas. We look for croissants. We look for chocolate, food that's very caloric, that's going to give us the energy that we require because we haven't been able to sleep properly. And this also results in reduced physical activity because we're tired. So this is a typical vicious cycle that we cannot break easily. When we're more tired, we feel less active, we're less active, we sleep worse, we feel tired in the morning. So this is really a cycle that has to be broken because otherwise we're going to have more risk of overweight and obesity. Also, studies have shown that when we sleep less than 6 hours a night, we're going to see increased levels of ghrelin, which is a really important hormone modulating appetite and hunger. When ghrelin increases, we feel more hungry. Sometimes it's not real hunger from our stomach, but it's emotional hunger when we feel like we need to eat more, but we really don't need to eat. Also, we have more salt retention. We have an increase in inflammatory markers such as C-reactive protein, which is also associated with overweight, and also decreased levels of leptin, which is the hormone that sort of opposes the actions of ghrelin. So it's the hormone that is going to allow us to feel satiated and control our hunger. Now, I just wanted to talk about cardiovascular health. You know, cardiovascular disease is the #1 killer worldwide, so it's really important that we treat all the possible risk factors of heart disease. And of course, sleep and adequate sleep is one of the things that we can do. I talked about before obstructive sleep apnea. This happens when people are usually overweight. Also can happen in people who have thick necks, who snore at night, who usually don't feel well rested in the morning. People who have these types of symptoms must see a sleep specialist because they need to undergo special testing. If they do have obstructive sleep apnea, there are treatments such as CPAPs, devices that can improve oxygenation, because what happens in these people is that they do not have adequate oxygenation at night. That's going to affect our brain health, and also it's going to affect our heart. And when we don't sleep well, we have an increased sympathetic tone in our nervous system. So we have the sympathetic nervous system, which is that system that sort of makes us ready also for the day, increasing adrenaline or adrenaline. These are hormones and neurotransmitters that are very important for energy. But the constant high levels of these chemicals in our blood are going to increase the risk of atherosclerotic plaques, which is cholesterol plaques around our arteries, and that's going to also increase our blood pressure. And these two are the most important risk factors, both for heart attack and for stroke. And this graphic over here on your right, Life's Essential 8, this is actually a graphic developed by the American Heart Association recently, and they included sleep as one of the Life's Essential 8 modifiable lifestyle factors in order to reduce our risk of heart disease. So we need to eat well, eat a healthy diet, exercise, control blood sugar, everything that's there in those diagrams. And one of the most recent ones is adequate sleep to decrease the risk of heart disease. Also, sleep is associated with cancer. So recently, the World Health Organization has included night shift work or night work as a probable carcinogenic factor to humans, because we have seen by studies that they have performed that cancer is, or that night shift work is associated with an increased risk of several different cancers, such as prostate, breast, and colon. Okay, so those 3 types of cancers have been associated with night shift work. And why does that happen? Well, cancer is a disease of inflammation. We have said that sleep increases our inflammatory markers. Poor sleep, increases inflammatory markers. It also decreases the action of natural anti-tumor substances that our body produces on a daily basis. It alters metabolism, as we said before. Poor sleep increases risk. So risk of obesity and overweight, and obesity itself is a risk factor for cancer. Okay, so that's really important. It increases the levels of stress. Stress is also a risk factor for cancer, and it alters our immune system, and that's going to be the next slide. So sleep and immunity. This is really important. When we sleep, we talked about the different phases of sleep, and during that deep phase of sleep, during that last phase of non-rapid eye movement sleep, our immunity gets sort of recovered for the day, okay? And part of the role of the immune cells in our brain, which is called the lymphatic system, the glia cells of our brain make up that lymphatic system of our brain. What they do is, at night, during that deep phase of sleep, is that they clear the waste matter of our brain, okay? And that's done by our immune system, as I said before. And one of the major roles of that system is clearing out tau proteins and beta amyloid proteins. These 2 are really important in the development of Alzheimer's disease. So maybe some of you have heard about it. These proteins accumulate as plaques in our brains, and poor sleep decreases the action or the activity of the lymphatic system, making us more prone or with higher risk of developing Alzheimer's disease. So basically, there are effects of sleep deprivation, of acute sleep deprivation, and also chronic sleep deprivation. In an acute setting, we're going to see less activity of our lymphocytes, of our immune cells on a daily basis, and important processes that happen on a daily basis. But chronic sleep deprivation is going to increase our risk of dementia and more severe problems, okay? And I just wanted to bring these 2 studies up because I thought they were super interesting, because always the in vitro, the cellular, the metabolic, scientific studies that measure immunity are really interesting, but when you sort of extrapolate those to actual studies that are done in human subjects, it really becomes much more interesting, at least to me. So there was one study that was done exposing subjects to rhinovirus. It was actually a really interesting study because they took rhinovirus drops and they gave it to all the subjects, and they compared how they then measured how many of them developed symptoms, and they realized that people who had poor sleep, less than 6 hours of sleep a night, had 3 times more risk of developing the common cold compared to those who had sleep properly at night, or more than 7 hours of sleep. And then also there was another study where they measured the immune response, the antibody response, when people were vaccinated with the flu shot. So people who had poor sleep had less quantity of antibody production after they had given the flu shot, and people who slept properly had more antibodies produced. So basically, this is your cue of, before you get your flu shot, get a good night's sleep. And then also sleep and cognitive health. So as I said before, there are some effects of poor sleep in the short term. You're going to have difficulty concentrating, you're going to be irritable. Remember that we have this area in our brain that is called the prefrontal cortex, and that's sort of the CEO of our brain, who controls all the systems and who gives us this filter for impulsivity. When we don't sleep, and that prefrontal cortex is really intimately connected to the amygdala, which is the emotional center of our brains. So whenever we feel angry, sad, irritable, our prefrontal cortex is able to control those emotions, modulate those emotions. When we don't sleep properly, that connection between prefrontal cortex and amygdala is broken. So if we don't sleep properly, we feel irritable, we feel sad, we feel angry, and we're not able to modulate, to manage those emotions properly. And that's going to happen in the short term. We're going to have impaired memory. Of course, we're not going to be able to consolidate those memories at night. And then, of course, in the long term, we're going to have poor work performance. We're going to have cognitive decline, as I said, heightened or increased risk of dementia. And then we're going to talk about some sleep hygiene measures.
Thank you. Okay. So at this point, we are approaching the last section of this presentation, in which we will cover, what can we do, to improve the quality of sleep. And we would like to introduce to you the concept of sleep hygiene. We are all, I guess, more or less familiarized with that concept of hygiene means, but how to apply this to sleep is what we would like to cover today. Perhaps I'm not discovering to you anything new, because these are very basic questions, but sometimes people don't realize these things and how to improve the quality of your sleep, So what are the necessary measures you have to, definitely? So linking a little bit this sleep hygiene concept to what we've heard over the presentation, the first icons or the first concepts we would like to talk about is the schedule, Sleep is something that it's recommended to be scheduled on our daily lives as much as possible. It is important that our calendars include sufficient time for sleep, and that sleep time is respected as much as possible. We cannot allow to have in our calendars time for sleep and then consume or use that time for other purposes, depending on the day. For example, that you have to work from 8 to 5 every day, that you have slotted this time for doing this, doing that, going to cinema, whatever other activity. Sleep has to be considered a necessary activity within your calendar days every day, and you have to respect that and not consume time of sleeping for performing other tasks, perhaps tasks that you don't have sufficient time over the day to do. We have to run away from this. We have to have this time scheduled, as I was saying, and it has to be scheduled every day, more or less around the same time. You have to go to bed every day around the same time. We know that days are never perfect, and there are unexpected circumstances or situations coming our way that makes sometimes impossible to meet that calendar, but to the degree it's possible, we have to accommodate to grant us sufficient time of quality sleep every day. The third thing I would like to comment on has to do with exercise and physical activity. As we have heard already, thanks to Dr. Silva, physical activity is helping us to improve the quality of the sleep. But physical activity needs to be aligned with the natural biology of the body, concentrating physical activity and exercise on the times where we have peaks, or rises in hormones facilitating that to happen, and not doing exercise, if possible, during the time that the body is asking you to relax and to go to sleep. I was using as an example during the previous presentation, these people that like to go to the gym, 11 p.m. every day, and then have dinner around midnight and then try to conciliate sleep. It's absolutely impossible. I don't know how these people do it. I'm personally incapable of doing this, and I would not recommend you to do that. Talking about food, for example, it's important as well, as we've heard, that we don't give wrong stimuli to our body and organism, and that we try to reduce the amount of calories intake over the course of the day. So over the afternoon and during the evening, we reduce excitants, caffeine, etc. And we try to reduce calories as well to prepare for sleep and not to demand your body to be over-digesting and overworking during night, so we can relax and the digestive system, etc. can meet their function while we're sleeping. We've told about exercise, but today we have something which is very dangerous, which is the use of screens. Screens on themselves exert a series of actions and demands on the body. But in the same way, some people get sleep facilitated by, for example, doing a relaxing activity like sleep when they are at bed. The use of screens has been demonstrated, and every day we are getting more and more consciousness on how detrimental they are for quality of sleep. So these people that go to bed and instead of trying to sleep are constantly using their phones, their pads, their laptops, etc., may get poorer quality of sleep. Last but not least, some very basic concepts about the environmental hygiene questions we need to take into consideration in order to grant better quality of sleep. We have to make ourselves used to go to bed every day at the same time, to try to go to sleep every day in the same place, because there are people who go sometimes to bed, sometimes they fall asleep in a couch or the sofa, sometimes doing whatever they think. No, we have to accustom ourselves to go every day to bed. And that bed and that bedroom has to be a place that's comfortable, is visually appealing, is relaxing. If the room is totally untidy or has aggressive colors or an aggressive decoration, is not facilitating that we link the concept of going to bed or going to our bedroom to something that's relaxing. It's absolutely impossible. In that same sense, temperature, environmental temperature is very important, and we all have experience, I think, to a certain degree, how bad or how poor we sleep, in seasons where there are extreme peaks of temperature, either very high or either very low. So it's important that we try to keep that as comfortable as possible. Same with the noise and same with the lights, At the end, we are all animals, and even though our eyelids, for example, are closed and we have the perception or the sensation of being slept and not having any relationship with the environment, light is able to make its way through, and it's giving, a negative or a contradictory, if we may say, information to your brains, asking them to activate. And I was using, for example, during the previous presentation, what happens with these people that are lucky enough not to have to wake up at 5 a.m. or 6 a.m. every day and can afford waking up at 7, 8 p.m. There is a time frame, especially in this time of the year, in this season, where we are seeing sunlight every day sneaking through the window at a very early stage, and you are forcing yourself to sleep during those hours, and your brain is perceiving this light and is activating while you are trying to make the most out of this extra 1 or 2 hours we have in bed. And that translates into a poor quality of sleep, contrary to what you may think. So it's important to make the room as well, be as much as possible aligned to the natural cycle of the light in your surrounding environment, and to adjust to your own biology, as we have heard during the presentation. And with that said, I'm going to hand over again.
No, you have one more.
Oh, well, yeah. This is just to kindly remind you that during lifetime, the necessities of sleep, the perception about quality of sleep, and the necessary hygiene measures to be taken may vary as well. There are some things that could be specific for babies during your youth or childhood, when you're a teenager, and some people when they come to an elderly stage. They find, for example, that with just 3, 4, 5 hours as much, they get quality of sleep, and some of these hygiene measures are not valid anymore for them. That varies over life, and there are some specific things we could be doing. There is no one-size-fits-all formula that may help you, and we need to understand that this is something naturally evolving as we grow older, and that we need to adapt to the circumstances of our specific age and time, and take the necessary corrective actions in order to ensure that we are benefiting from a good quality of sleep. And now, thank you very much for the reminder. Over to you for the final.
This is the last slide, so we just wanted to end before we move to the fact versus fiction statements and try to solve them quickly before we finish. I just wanted to mention briefly what the treatment is for sleep disorders. So nowadays, one of the mainstays of treatment for insomnia and sleep disorders is cognitive behavioral therapy. This is performed by specialized therapists who train in this matter, and basically the hope or the expectation is that the therapist is going to help the patient have a better relationship with sleep, not only improving their sleep patterns, their sleep hygiene, but also how they feel towards sleep. Sometimes when we don't sleep, that generates anxiety, and that anxiety itself just worsens the sleep disorder. Okay, so that's one of the mainstays of treatment right now. We also have medication. Benzodiazepines are probably one of the mostly abused medications, unfortunately, worldwide. Of course, some people require these medications for sleep. They are not recommended without a prescription and without adequate follow-up. And also, we usually use them for short periods of time until we really try to treat the cause of the disease, and then hopefully stop it. Also, we have some supplementation. I'm going to include this in medication just because it's something that can be taken as per mouth, as drops or pills. One of the most popular supplementations for treating sleep disorders is melatonin, which can be bought over the counter. And melatonin is really useful, for example, in jet lag, as we were explaining before, because it's a way of inducing the sleep when we change that sleep clock. Usually it's just used for short periods of time. It's good for induction of sleep, but if we have trouble staying asleep during the night, it might not be the best alternative. All of this should always be prescribed by a doctor, or at least talk to your doctor about this. Please do not go and get all the supplementations by your own, because they are not, they have effects. So they have to be given at adequate doses and with adequate instructions. Magnesium is also one of the mostly sold supplementations for sleep. Magnesium is thought to relax our nervous system, our muscles, and it's thought to help in staying asleep during the night. Some people require surgery, of course, if there's some sort of alteration in your pharynx, in your neck, something that's obstructing your airway. Of course, surgery would be the way. Some self-help strategies, relaxation techniques, mindfulness, all of the possible techniques that we can use in order to decrease our cortisol levels, our levels of stress, are going to be very helpful in improving our sleep pattern. Of course, all the healthy sleep and healthy sleep hygiene recommendations that Alejandro just spoke about. And then there are ASMR techniques, which basically make reference to potential techniques such as white noise or massages or sleep or sea ocean noises that are pleasurable for us and that makes us relax, and that has shown to also help in improving sleep and sleep induction. So basically, that was all for today. I don't know if you have any questions, if anybody has written any questions down, or maybe we can go back to the fact and fiction slide if nobody has any questions.
So I'm not seeing any interaction from Virginia or Natalia just yet, or from Alvaro. We'll give them some time. Maybe they come up with some questions. I just want to reiterate that we are almost done with the session, but since we started a little late and we have still the Q&A, we'll try and prolong it for 5, maybe 10 minutes if you all want to join us with this. I would like to pose a question and that I didn't get to ask in the previous session. How much of an impact does the sleep mattress have and your posture while sleeping? And your posture. And what would you recommend? What would be, how do I find the best mattress? In which position do I sleep in? I know I could answer in whatever possible, in whichever posture possible, but maybe you can give some insights into that.
It's a good one.
Go on.
Well, I'm not an expert on that, but that has perhaps more to do with postural hygiene, no? And the same principles about postural hygiene, especially for the back and the joints, may apply as well to the postural changes required in order to grant sufficient quality of sleep, no? That has to do with, well, everyone, I guess, sleeps in a different posture. No, we've seen that, especially when you are in a couple, for example. No, it's very complicated, and it's one of the questions people most complain about, no? The best posture defined for getting proper sleep is standing up in the good supine position, no? I would say, no? Which is with your back completely laid down, no? And if possible, with your knees a little bit bended over to ensure that the lumbar side of the back gets proper relaxation and it's completely laying down on the mattress. That can be, for example, facilitated by using, for example, a cushion or a pillow that you can place, underneath your knees in order to facilitate that posture. Because otherwise, that curiously, human is the only animal that when it falls asleep, loses completely, body tone, muscle tone, and falls into relaxation. We all have seen, for example, animals sleeping on branches or on the countryside, and they keep a certain degree of muscular tone. Contrary to what happens with them, the human body, humans tend to relax in full. So in order to preserve that posture I'm talking about, it's indispensable to keep something to hold your knees that way. So that's the most commonly accepted and best posture for that. Neck is also important to put attention. Neither too bended backwards, neither too bended upwards. It's variable depending on every individual, because feeling comfortable for people like me who have a very long neck, it's absolutely impossible to find a pillow that's suiting, and it's making us feel absolutely comfortable. But there's no formula, and we need to adapt to that. But this is the most common posture. For people who find absolutely impossible to sleep that way, or who have, for example, sleep disorders like sleep apnea, since they have to bend down or lay down on one side, in order to preserve postural hygiene, it is recommended, for example, to put a pillow between the two knees, for example, to avoid damage to the joints and facilitate relaxation. But I don't know if there's any other specific measure.
No, I think that's, you probably covered everything. Yeah, I think so. I think there's a few questions.
Was that helpful?
Sure. No, you covered it really well. Wanted to just share a comment that Alvaro made. He said that when he wanted to share that he moved to the UK, while over there he used to sleep without blinds. So when he moved back to Spain, he found it much easier to sleep with his blinds up. But he woke up, that made him wake up more energetic than having it completely shut. He says that it does not make much sense, as I know and heard from you both, that having it up makes your brain wake up earlier. But if I don't do it, it takes me longer to activate in the morning. That's just a comment that he posed. And Virginia just shared that I've heard that when we are sleeping, the heat goes down from your brain to your feet. So it is better to sleep without socks? Is it a fact?
Okay, just to answer Alvaro's question, because I think it's super interesting, because he's actually right. And people who are actually in Spain, I think it's one of the few countries where we really sleep with those thick blinds. I'm from Colombia, and we don't sleep with blinds. In Colombia, sunrise is really early, and that also makes us activate earlier and finish the day earlier. So it makes sense, because when you get, as Alejandro was explaining, when you get that light stimuli to your eye through your eyelid, you're gonna get, activity going on in your brain. Cortisol is going to increase, so that's gonna make you activate probably better, especially if you're used to it. But then you have to also take into account that you need to sort of wind down earlier at night as well. So if you're gonna have a really early morning because of this light stimuli early in the morning, then you have to also wind down at night with the appropriate darkness. So it makes perfect sense. It does. And if you sleep that way and you feel like you're well rested, I wouldn't recommend otherwise using thick blinds. I think it's not gonna give you more benefit. But also, and then before we move to read Davara's comment for Virginia, just really quick, because I think it's fascinating to think about sleep, about feet being covered during sleep. Some kids actually have problems with enuresis, which is, urinating at night in their bed because they have cold feet. And it's actually kind of, the explanation is not really that clear, but it really happens when you have your feet covered. You have better thermoregulation in general. So your body, as Alejandro was saying and we were saying before, drops about 1 degree Celsius at night, but it's your entire body. So I'm not sure whether, your brain, sort of the temperature drops from your brain to your feet, but feet do play an important role regulating temperature in our body. Okay. And I don't know if you want. I'm sorry, I sort of monopolized the answer.
No. That's perfectly fine. Nothing else to add.
So would you suggest, is it better to sleep with socks or without socks?
In kids, I think it makes sense if they have some sort of enuresis problem. In adults, usually because it increases your body temperature, I don't know if it's going to be comfortable. So it sort of depends.
Some people sweat, some people find them uncomfortable. And at the end, it's about what works for you. If you feel more comfortable and that helps you and contributes to your quality of sleep, please do it.
Definitely.
And if not, please don't force yourself to go through that.
Right.
Alvaro just made a comment following Daniela's explanation that it makes sense what you're saying, that people in the UK normally go to bed very early.
Earlier,
So,
yeah, that's right.
Absolutely, Alvaro. Feel free, please. Feel free to unmute yourself and participate in an active way. Yeah.
Sure.
But at the end, what we were saying, Alvaro, has to do with conciliating your work and life habits with those biological patterns or those seasonal patterns. My comment was more on those questions where instead of waking up, you force yourself to continue sleeping while the sunlight is sneaking already through the window, or for that people that unfortunately live in front of a street lamp and have that light stimuli constantly delivered onto them, or people who tend to fall asleep in a bedroom or whatever other place, with their lights open. That is giving contradictory information to the body.
I just unmuted myself. I also wanted to share.
Wait, we can't hear you. Hold on.
1 second, because we don't want to miss anything you're saying. We're struggling to hear.
Go ahead.
Sorry. Can you hear me now?
Yes.
Much better. Thank you.
All right. Hi. So absolutely true what you were both saying. First of all, many thanks to the three of you for this wonderful presentation. Continuing on what I was saying, I find it really, when I came back from the UK and moved back to Spain, which I am from, and it's where I have been born and bred, I think it's very hard, and it's something that it's said continuously, that true to say that in Spain our timings are completely the opposite way to many other countries. I mean, it would be wonderful if we had dinner way earlier, and when it's dark we all go to bed, which is completely different to other European countries. I mean, we here have dinner 9:30, 10ish, and then we go to bed very late. Me, the first one. I mean, I'm never in bed before 11:30. So, which is completely different to my way of living when I was in the UK, because my job allowed me to be in bed around 9:30 and wake up with the daylight. So, it's completely true what you were both saying, and it's completely incredible how we can live in this country with these timings.
Yeah, absolutely. And also the fact that we have dinner at night so late, as we were saying before, it also affects our sleep pattern. If we have a heavy meal at night, we're going to sleep poorly. And many times when we sort of talk with patients and we try to, even though it's difficult, we try to move dinner time earlier, they feel a really big impact on their sleep quality. So definitely, it's a matter of trying to adapt our our cultural and local routine to healthy habits. But yeah, it's hard. It's hard. And only just to answer some of this factor of fiction, because I think some of the questions weren't answered. So all adults should sleep 8 hours a day. Usually 7 to 8 hours is the magic number. So yes, 7 to 8 hours should be reasonable. When we sleep, our brains are shut down. No, when we sleep, our brains work. They just work in a different way. Daytime naps are never recommended. Actually, small power naps could be very useful if we have, for example, in our previous talk, there was one of our colleagues was saying that she has a baby and then her sleep at night is sort of fragmented. So in people who have night shifts or who have this sort of alterations, power naps, 20-minute power naps during the day could be really restorative, and they could be recommended. We talked about the quality of our food. If you want to take the following, I'm happy.
What about the wine?
Yeah, that one, exactly. Or whichever one you want.
Yeah.
I just don't want to talk.
Of course. No, linking back to the previous thing I mentioned about sleep hygiene, no? Wine, well, helps to conciliate sometimes, but it's reducing, no? The necessary time it takes to get into deep sleep and into pass through all the different stages of a normal sleep cycle. So it's not recommendable at all to abuse from alcohol or other potential drinks, like for example caffeine, no, close to getting to bed. No? What was it? Sorry, I'm short-sighted.
Older adults require less hours
Yeah.
of sleep.
Older adults require less. Sometimes they do, sometimes they don't. No, normally yes, they require less, but at the end, like Dr. Silva has mentioned, it's not about the amount of hours, it's about the quality of sleep you get during those hours and what works better for you. No? Yawning is always a sign of sleepiness. I don't want to ask how many times you have yawned during this presentation. And sleep trackers are a great and reliable tool to measure the quality of our sleep. That I'm going to hand over to.
Okay. Yeah, I mean, sleep trackers are really in fashion right now, and I think everybody or a lot of people are sort of obsessed with, iWatch and all of these devices. We have rings, we have all of this really cool stuff that claim to measure our quality of sleep, and they're actually okay, but we shouldn't get obsessed with them. So if you're having sort of this just curiosity of how well you're sleeping, that's fine if you use them, but then they're only measuring markers of phases of sleep. So we know that our heart rate drops, our body temperature drops, and our heart and our respiratory rate drops during the night, and it sort of drops in a different way in every one of the phases of sleep. So these sleep trackers measure those parameters, so they are sort of good markers of our sleep quality. But for example, if you lay down in bed and you are meditating, you're relaxed, you're having a respiratory exercise, your sleep tracker might track that as you're having light sleep, for example, and you're actually not asleep, you are just relaxed, but you're awake. So they're okay, but we shouldn't be obsessed with the data that these devices provide, basically.
Okay, so we went a little bit over our time. It's almost 12:30, so I think it's a good time to end it. I will thank you all for coming here and listen in. If you have any questions, I'm sure that Daniela and Alejandro will be very happy to answer any questions. You can post to them.
Absolutely.
through our WebEx or maybe an email. Just email them. They will be happy to help. Again, I hope you enjoyed this, and see you on the next one. Bye.
Thank you very much.
Thank you.